First of all, I would like to thank Nestlé for the invitation. My name is Noemí Tomsen. I'm a postdoctoral researcher in the Gastrointestinal Physiology lab in Mataró, and I'm going to present the effect of a novel liquid thickener on hydration status in patients with oropharyngeal dysphagia. The slides show the outline of my presentation. First of all, I will make a short introduction talking about the main complications of dysphagia, focusing on dehydration and the results of a systematic review on dehydration in dysphagia. In the second part, I will explain for the first time the results of a clinical study we performed together with Nestlé. And to end my presentation, I will read the take-home message. So, as you know, there are several complications associated to dysphagia. The impaired efficacy leads into dehydration and malnutrition due to the inability to swallow all the liquids and nutrients, while the impaired safety leads into respiratory infections, aspiration pneumonia, and an increase in the mortality rate. And as you can see in the screen, the prevalence of these complications are very high in patients with dysphagia, up to 50% for aspiration pneumonia and malnutrition, and up to 100% for dehydration. However, the most neglected and underdiagnosed complication is dehydration. It is known that the dehydration we observed in older patients with dysphagia is characterized by having a depletion in the intracellular water and also a reduction in the phase angle. And these impairments leads into other complications for the patients, such as a reduction in the saliva volume and also a loss of the muscular strength. So we can say that dehydration, if not treated, could lead into an impairment in the functional capacity of our patients. And in this systematic review, we aim to study the published data about dehydration in patients with dysphagia and also the therapeutic effect of thickened fluids on it. And the results we found could be summarized in 4 points. The first one is dehydration is a highly prevalent complication observed in 19 to 100% of patients with dysphagia. The second, the best biomarkers to monitor this condition are bioimpedance, including intracellular water and also the phase angle, and biochemical parameters, including the pancreatinine ratio. That there is scientific evidence on the positive effect of thickening fluid therapy on the hydration status of patients with dysphagia, and finally, that the strict monitoring of fluid intake is essential due to the low consumption. But the main limitation we found while we are doing this systematic and scoping review is the low papers published about this field. And this is why we designed, together with Nestlé, the clinical trial entitled Evaluation of Swallowing Function and Hydration Following Consumption of Thickened Gel Express in Patients Affected by Oropharyngeal Dysphagia. As you can see, the study had 2 main parts. The first one aims to study the effect of thickened gel expressed at increasing viscosities on swallowing function, and the second part aimed to study the effect on hydration status, acceptability, gastrointestinal tolerance, compliance, and palatability. And today I will show you the results of this second part of the study. So the primary objective of the second part is to study the acceptability, gastrointestinal tolerance, compliance, and palatability, and the therapeutic effect of 14-day intervention with thickened fluids using thickened gel express on hydration status in patients with dysphagia. So we designed a prospective interventional pilot study in patients with dysphagia. The main inclusion criteria were to be more than 18 years old and had dysphagia with impaired safety of swallowing, assessed by BBSD and also with BFS. In addition, patients or their caregivers had to be able to record a daily gastrointestinal symptoms, compliance, and fluid intake, also had to respond the acceptability questionnaire, and willing to only use the study product. The investigation product was thickened gel express at 4 different viscosities: slightly thick, nectar, honey, and pudding. The study includes 2 visits. The first one was a baseline visit, where we assessed the swallowing function using the BBSD and BFS. And we also collected some blood and urine samples and performed a bioimpedance in order to study the hydration status. Then the patient had to follow our viscosity and hydration recommendations for 2 weeks, and they had to complete different questionnaires. The acceptability test, where they had to rate some aspects of the product like the taste or the smell. The gastrointestinal tolerance test, where they had to report any gastrointestinal problem they showed. And finally, a daily diary, where they had to write for each day of the treatment the amount of the product they prepared, the amount they actually consume, and In addition, if they drink any fluid without using the thickener. And when they finish the treatment, they come up to our unit and we assess again the hydration status using blood and urine analysis, the bioimpedance and the fluid intake, and review the responses of the questionnaires. So once we evaluated the inclusion and exclusion criteria and the patient signed informed consent, we performed the MNA and E10, the bioimpedance, and the BBST. If patients show safety impairment signs, then a bit of fluoroscopy were performed. And again, if the patient shows safety impairment signs and a PAS score higher than 2, the patient was included to the study and we collected the blood and urine samples. When we analyzed the sociodemographic and clinical data, we observed that the 16 patients included in the second part of the study were about 70 years old, that most of them were men, and that they were at risk of malnutrition or of having dysphagia. When we analyzed with the fluoroscopic results, we observed that all of them had efficacy and safety impairment signs, of which the 43% were aspirations, and with a mean PAS score of nearly 5. In addition, we observed a delay in the laryngeal vestibule closure time. And finally, regarding the hydration results, this table summarizes the main parameters, biochemical and bioimpedance parameters we use in order to know if patients were dehydrated or not, and we observed that the 81% of them were dehydrated in this baseline visit. So for the treatment period, the most viscosity recommended was nectar, followed by honey and slightly thick, and none of the patients need pudding viscosity. In addition to give them viscosity recommendations, we explained them how they had to prepare their fluids using Thicken Up Gel Express, and also gave them basic hydration recommendations. And when we analyzed the average fluid intake during this 14-day intervention, we observed that these were about 1,400 milliliters per day, of which the 87% of the fluids were thickened using Thicken Up Gel Express. And when we analyzed the hydration status, we observed several significant improvements in some hematology and biochemistry parameters, including hemoglobin, calcium, magnesium, or urea. And when we recalculated the prevalence of patients that were dehydrated, we observed that we were moved from the 81% we had in the baseline visit to a 62% in only 2 weeks. And finally, regarding the results of the questionnaires, we can say that Thicken Up Gel Express was very well accepted, as patients rated very well the smell, the taste, and the texture, and also the 62% of them say that it is easy to drink fluids using this new thickener. And regarding the gastrointestinal tolerance, none of the patients reported any major gastrointestinal problem, but it's important to note that few of them reported changes in usual number, size, and consistency of stools. Also, one of them reported tummy pain, and the most reported symptom was an increase in barfing or flatulence by 33% of the patients. So in conclusion, we can say that an optimized 2-week hydration intervention based on the severity of dysphagia and tailored to the optimal viscosity level of thickened fluids with Thicken Up Gel Express significantly improved the hydration status of patients with dysphagia, and that Thicken Up Gel Express was well accepted and well tolerated in patients with dysphagia without serious gastrointestinal side effects. And as take-home message, oropharyngeal dysphagia is a very prevalent condition in older people and have severe complications. Dehydration affects up to 100% of patients with dysphagia, and it is underdiagnosed. And finally, an active 2-week intervention using Thicken Up Gel Express and a strict monitoring of fluid intake improve hydration status in older patients with dysphagia. And as you know, nobody works alone, so I would like to thank the Mataró team for their contribution in the study, and also thank you for your attention.